Good afternoon. This is American Surgery Center with CHRIAS. My name is Kemal Erkan. I'm the chairman of American Surgery Center. I'm here with Dr. Isaias Irgau. Dr. Irgau, how are you doing?
I'm doing great, Kemal. Thank you. It's great to be back on Bariatric Friday again. I'm glad we overcame the technical glitches and we can get the show going.
Of course, so no problem. We are actually, we were at the end of our Samantha and Katrina cycle. So this would be the time that we are going to wait for their results. So they had their surgery. So before we start, if you can have a brief background on the bariatric surgery and qualifications and the program, that would be great.
Absolutely. Thank you, Kemal. Again, everybody, my name is Dr. Irgau. I'm the president of CHRIAS, or Christiana Institute of Advanced Surgery. My specialty is weight loss surgery, bariatric surgery. And bariatric surgery is a specialty that is geared towards treating morbid obesity and the health problems associated with morbid obesity. Morbid obesity is defined as obesity where the person's weight is at least 100 pounds higher than their ideal body weight. Another way to quantify that is to talk about body mass index, which is a number that is calculated by placing the height and the weight of the person together. So we talk about morbid obesity when that number reaches the number 40. So 40 would be a BMI that would qualify a person for weight loss surgery or bariatric surgery. Sometimes a BMI as low as 35 can qualify a person for weight loss surgery if they have already developed illnesses related to morbid obesity, particularly things like high blood pressure, type 2 diabetes, or sleep apnea. Currently, bariatric surgery is by far the most effective treatment we have for morbid obesity, which is a condition that is greatly affecting our society. The problems associated with morbid obesity happen to be also the main health problems that are the leading causes of mortality in our country, including cardiovascular disease, cancers, and metabolic illnesses like type 2 diabetes.
So, Dr. Irgau, thank you for the background on the bariatric and the morbid obesity qualifications. Now, I'm going to actually take us to a little bit different. I'm going to try to kind of approach this from a different perspective. So as I was trying to get ready for our new cycle, and then this time we have 3 patients, so I'm going to introduce them later on. So, and we are going to go to this journey with them as we are waiting for Samantha and Katrina. Now, I was looking for images to use. And I tried to use the cartoon so that it's not affecting, any real person. So then we can actually. But then there's one of the shows that I actually watch. I don't know. I don't watch it anymore, but I used to. Family Guy. So when I see these guys, this is I think Peter and Chris. So this is one of the most famous shows ever in the last 10 years, I would say. Now, and because we are in the morbid obesity world every day, sometimes our perception, our understanding, when we look at everything, we look at it from a different perspective, because there's always this clinical side of it. So how many times I want to give our business cards to one of the people that I see when I'm out in public. But when I see this, I actually saw it first time in a different perspective. I'm like, okay, when this is a really good show, like happy show, and then everyone is kind of like, overall, they live their normal life. The father is morbidly obese. The son is morbidly obese. Pretty much this is out there, and I just want to kind of hear from you what you see or what your perception or perspective is when you see these, and what kind of message this is giving out to the public.
Kemal, I really appreciate that. Actually, this is an important topic. As you know, for myself, my colleagues, our bariatric center, the whole of our specialty bariatric surgery, morbid obesity is not a joke. It's a very, very serious problem. It is a serious problem that really is actually a life-threatening condition if you think about it. When you know that the higher the person's weight goes, the higher the chances of them dying early, you know, it's a major problem. It's a major health issue. And because of that, we are applying very serious surgery to tackle it, right? We are telling people you must undergo surgery for us to be able to help you and resolve this problem. So clearly, from our point of view, morbid obesity is far from being a trivial issue. And yet you are bringing up a very, very popular show in our country where the main characters are morbidly obese. And there are really two aspects to that, aren't they? First of all, it just is, as you were saying earlier on, normalizing morbid obesity, right? Something that is part of us and acceptable. And in a way, you cannot fault them, right? Because morbid obesity has become so pervasive in our society, right? You go out and you walk around, it is very hard to find a person with a normal weight. Almost everyone is overweight, and many people are morbidly obese. So it is part of our society, part of our reality. And the show is reflecting that in a way, right? But the other aspect to that is that they perhaps have chosen those characters who are morbidly obese in order also to show the trivialization of morbid obesity, right? Mm-hmm. Making joke about somebody who is heavy right now is probably the still acceptable form of discrimination in who is heavy, and portray them in a funny, in a show that many people find very entertaining, right? So when I look at it, obviously it is telling me so much that I know. And that is, first of all, morbid obesity is here and firmly entrenched in our society, right? No matter how much you and I are doing with bariatric surgery, we're barely scraping the surface of morbid obesity, as you know, because on how many patients are we going to be able to operate, right?
Exactly.
As you very often say, maybe about 1% of the patients eligible for morbid obesity are actually coming for the most effective treatment we have for morbid obesity, which is bariatric surgery, right? And then on the other hand,
you know, how normal they live their lives. Mm-hmm. So there's no health issues. There's no, well, of course, this is a cartoon and they're doing it for entertainment, but it seems like, well, we are, okay, fine. They do it for entertainment, but do they have to do it in the way that they are normalizing morbid obesity? So, like, okay, there's Peter who's already morbidly obese for the last 10 years, and he's happy. He doesn't have any health problems. Mm-hmm. He's still getting into trouble. And Chris is the same way. So then he's a happy 10 or 12, or I don't know how old he is now, but they don't age. So this becomes the new norm.
Absolutely.
So now I'm not saying that they need to filter what they do in the entertainment world, but the impact, like they can do this for a patient with diabetes, they can do this with the patient with heart disease, they can do this with the patient who has other type of disease, chronic illnesses. But then I see a little bit, maybe like more from the social responsibility standpoint. I saw it first time in a different way, and that was kind of like, in a way, it was kind of scary.
Absolutely. But I mean, that is really an underlying theme in our society right now, right? So, Kemal, I mean, you and I struggle more to explain the rationale for the treatment of bariatric surgery to payers, to family members of patients who are struggling, right? Mm-hmm. And to others, right? We are struggling because people fail to see morbid obesity as a deadly disease, right? And it's no surprise, because even the medical profession itself was very, very late in recognizing this. It was only about 10, 12 years ago that the American Medical Association defined obesity as a disease, right? Until then, it was an issue of appearance. It was an issue of convenience, right? Yes, you cannot do certain things because you're obese, but so what, right? So what? Well, not so, right? There is type 2 diabetes, there is hypertension, there is sleep apnea, there are different types of cancers, and more importantly, there is that life that is curtailed too early. And this is all related to the weight, right? So there is a perception in society, again, that obesity is not really a serious health problem, right? And even if it is seen as something that is a person should be individually responsible, right? You are the reason for that. You can take care of it. Why don't you just diet? Why don't you just exercise and everything will go away, right? I just saw, before we came on the show and I had office hours, I saw a 23-year-old girl whose weight was up to about 315 pounds. 315. She's doing everything she can, everything known in terms of diets, and she's down to 286 pounds, right? And she's telling me, I am stuck at this weight. I cannot go any further no matter what I do, right? That's what she's saying. And now she knows she has to go and look into bariatric surgery for her to be able to resolve this problem. Now, it's not about willpower, right? There are many 23-year-olds that may be living a fairly healthy life, but without any difference in terms of how they live, in terms of their food choices and exercise. But the bottom line is that biologically, this young girl that has come to see is at a spectrum where her body really favors a much higher weight than not. So when she tries to lose weight, she is fighting this biology. In other words, to just tell her it's your fault, it's a question of willpower, you're really castigating her without giving her an option, really. And that's where we struggle to make our society understand that morbid obesity is not a choice. Morbid obesity is a disease. So, yes, there is a right environment which promotes that, but in essence, that's what it is.
You know, how many times we see this diagram? This is the weight measure for one of the patients. And then every day between different case conferences, we see so many of these. This patient was 225 in 2018, and then 21, they're already at 320. And they will, going back from that is almost so difficult. I don't want to say impossible, but next to impossible. So this is part of it from the patient perspective side of it. This patient doesn't have to live with this, but also like when we normalize it, that's kind of like the other issue that actually from the social stigma, maybe in a way it works in a different, like it's normalizing it. So look, this is okay to be morbidly obese, and you are going to be happy. You're going to be happy. You're going to be just doing whatever you were doing before. Nothing is changing. So on a different note, on a positive note, we have our Samantha and Katrina. They went through their surgery, so we are going to report back on them. Now, in terms of what's being expected, what they're expecting from this point and on, like 1 month, 3 months, 6 months, if you can just tell us where they are going to be, and then we can actually, when we report it, we can actually talk about them a little bit.
Absolutely. Come on. The subject that you brought is too important. I do want to add a few things before we go to Katrina and Samantha.
Okay.
And that is this issue of normalization and also applying the fault to the person, right? If our body behaved in ways that we think it behaves, just think about this. A person who is morbidly obese has extra fat in their body. And fat is energy, right? Energy is what our body needs for us to do anything, right? So why is a person who has so much extra food stored inside them hungry? Why would they be hungry? You would expect that person not to be hungry at all, to utilize the stores that they have. If our body behaved like a machine that didn't care whether we were heavy or not, that treated losing weight and gaining weight in the same way, if our body was not programmed for us to be heavy, you would expect that a person who is very heavy not to be hungry at all, right? And yet, the people who are very heavy are the hungriest. And the reason for that is because that biology is intrinsically hurting them, right? They are heavy, and yet their body wants them to be even heavier than that. So when a person is trying to lose weight, they are fighting an impossible battle. That's why it is so hard for people to lose weight. And this is important for people to understand. And part of the reason he brought up this issue, Kemal, is for us to make this point, which is a critically important point.
Well, I mean, because like there's another show that I do want to actually bring that up, South Park. So all the kids are morbidly obese, and then they're smaller than Chris, and they make they make fat jokes. So again, once it's there, once the kids see this as normal, then how are they going to actually make any changes? And what we know is now in the case, like we see Chris here, chances of him being morbidly obese for the rest of his life is so high. Okay. Because his dad actually is not doing anything with that, and then therefore he's going to be stuck with that, and it'll become more severe, right?
Absolutely.
So,
Absolutely.
And this is going to impact his life in so many different ways.
Yes.
So I mean, that was honestly when I was really looking for new pictures for our new patients. Just when I see it, I'm like, this is part of the problem. So you are normalizing it. So all right. So now can we go back to Katrina and Samantha?
Of course. So they've had their surgery. They are 2 weeks since surgery now?
It's about like when we were off a little bit. So they had their surgery, and then they're going to be back to the office for their first follow-up.
Absolutely. Absolutely. So both of them are doing very well. They are on their liquid diet phase for the first 2 weeks, which means that they are going to be focused on hydration, right? Because their stomach is very small now. They cannot drink a lot of fluid at once, so they have to learn really to get as much fluid as possible with little sips. And one of the strategies we tell them about is to take little sips continuously so that they're not behind on their fluids. There is a risk for them to be behind in their hydration, Kemal, at this stage, because not only they cannot drink a big gulp of fluid at once, but also they are not eating right now. They're not eating the big portions of food they were eating before. And as you know, a large quantity of the food that we eat is actually water. So we get our hydration from the food that we eat as well. So if you're not eating, it means that also you're missing that portion of your hydration. So hydration is a critically important thing we talk about. They are increasing their activity level. This is a period of rapid weight loss, so they are enjoying that rapid weight loss as well. They are feeling more energetic because of that. And we're telling them to increase their activity level. There are going to be some exercises that we don't recommend at this early stage. For instance, lifting weight, engaging their core abdominal muscles. Those are activities that we want them to wait until they're at least a month out from surgery. But walking briskly, stationary bike, elliptical, treadmill, all those things are not only okay, but we encourage them also to do that. Of course, it's a time also for us to make sure that there are no complications. So we ask them about fever, we ask them about pain, we ask them about nausea, vomiting, and I'm happy to report that none of them are having any of those issues, essentially. Both Katrina and Samantha were able to be off their pain medication within the first 48 hours after surgery, which is really great. They have very small wounds, which is from their laparoscopic surgery, and their wounds are healing very well. At 2 weeks, they would be allowed to go back to work if that's what they choose to do. The minimum we ask people to be off work is 2 weeks. But if they have flexibility in their job, I actually recommend that they are off for another 2 weeks or even longer if possible. And that's not because there are going to be limitations physically. It's because really we want them to go back to their routine at work once they have adjusted to the new way of eating. They're going to be on a liquid diet in this first 2 weeks. And then the next 2 weeks, they're going to be introducing what we call a pureed diet. Pureed diet would be a diet of food that has the consistency of baby food. One way for me to explain to patients on what a pureed diet is I tell them, look, eat as if you have no teeth. If you have no teeth, if you're like a baby, what would you do? You would eat things that don't require chewing. So anything that has been blenderized, mashed is absolutely fine. After that, they're at the 4 weeks, then they will be introducing their chewable food as well. So this is early time. We watch them. We ask them to call us if there are any problems. And then obviously we guide them through the progression of their diet and then increase physical activity.
So in the next 3 to 6 months, there will be a big weight loss for each of them. And they went through 2 different surgeries, gastric sleeve and gastric bypass. So, and then we are going to look at their resolution. And these are real patients. So we just have fake names for them. So in the meantime, we are going to start a new group who is, let me actually bring them up. So we have three people. So all right, so the first one is going to be Denise. So
Denise.
So these are again real people. And the second one, this time I have a guy. So we have Patrick.
Hello, Patrick.
And then we are gonna have one more patient, and that's Karen.
All right, wonderful.
So,
Denise, Patrick, and Karen are our next patients, and we will be journeying through the process with them. That's wonderful.
So I will be giving their background at the next session. So their age, their what they actually comorbidities and other stuff that they have. We'll do that, and then in the meantime, so going back to the patient perspective, so there's the issue of bariatric being like an elective surgery. Like we actually, first time we struggled with this when the COVID started. Many hospital systems, they said, well, we are going to postpone these procedures because these are elective cases, just like a nose job or a boob job. So like this is an elective case. Well, and then for the last so many years, we spent the time to make people understand that this is a chronic illness. And all of a sudden, we are being categorized as a elective case. So can we talk about that a little bit? Like this is not an elective case, right?
Absolutely, absolutely. When you think about the health consequences of morbid obesity, you cannot but compare it to serious illnesses like cancer. And when a person presents with cancer to their doctor, the sense of urgency is immediate, right? That needs to be taken care of, right? And yet, with with morbid obesity, we don't see that. As you said before, it's not unusual for a patient to have gone to their doctors year after year and adding their body mass index and growing their body mass index without the weight issue being addressed seriously, right? We don't see that as much nowadays, but that was a norm in the past, right? But what do we still see, Kemal? We still see insurance companies actually encouraging some employers to carve out bariatric surgery as a non-covered benefit, right? We still have patients who come to us seeking bariatric surgery. And then when we look at their own plan, we, to our disdain, we find out that bariatric surgery is actually excluded from coverage, right? So why would a serious illness like bariatric surgery be not covered unless people are really thinking of bariatric surgery as an optional procedure that somebody could do if they want, just as if they're looking at a facelift or as a nose job, as you mentioned, right? It is a health issue. It's a fundamental health issue. In fact, from an employer's point of view, you would think they would want to encourage their employees to become healthy from that point of view, because they are going to be much more productive for them if they are healthy, right? There are going to be much less work hours and work days missed because of illnesses and because of problems related to morbid obesity. And yet that lack of understanding of obesity as a disease leads to those kind of policies, Kemal, and that's our main problem.
So, and I think we were able to overcome that problem because we are in charge of our facility, and the American Surgery Center specialized in bariatric. That's what makes us probably better than anyone else in the region. And we're hoping that others would understand and see the same way. I think they did follow through at some point. But it was, even in 2021, it was a challenge for those who really didn't understand our fight, because we were told to hold all the procedures for like a couple of months. And if you didn't have the surgery center, this would be a huge problem. So that's what we have been seeing, what's been seen in the past. So hopefully that's not the case. Now, again, from the patient perspective standpoint, we are going to discuss the issues why some patients they drop
in the program.
In the program. So, every time that happens, we actually try to keep them in the loop in a way that we still send them an email every once in a while, so then they know that there's a choice. Because we haven't seen, one of the things that we do in the case conferences, we take a screenshot of the weight chart, the BMI chart. I haven't seen one single episode where the patient BMI was going down. So, and then I probably go through, I would say 15 to 20 patients every day, and haven't seen one who's actually losing. But were there some exceptions? Yes, but that was next to impossible again. So we are hoping that patients can take an action on these issues early on, so then hopefully we can make an impact on their lives. So,
absolutely. I mean, in terms of the natural history of morbid obesity, the other problem that is very important for people to understand is that when somebody presents to us, and they have a body mass index of 45, 46, right? The question that we try to explain is that not only it's going to be very difficult for them to lose weight appropriately without surgery once they reach that kind of weight, but it's going to be very hard for them not to gain any more weight, right? So it's not just, it's going to be hard for you to lose weight. It's going to be very hard for you to keep even at the weight where you are, right? Exactly. The chances are that if you come back in 2 years' time, we're not going to be dealing with this weight here. We'll be dealing with a weight which is much higher. Because as many patients will tell you, they go through a yo-yo of losing weight and gaining weight through their life. But as they are going through that yo-yo, every time they lose weight and then they regain even more, right? So although they have lost, when they regain that weight, they actually get back, not at the old weight, but a higher weight than that. So eventually the weight, even with that yo-yo, will be going up. So it's no surprise that when we see patients who drop from the program and come back to us a year to 2 years later, invariably their weight is higher than what it was when we left them.
And the other thing is that what we were able to do with our patients when we see the survey results, and even now I still receive those results on a daily basis, and I'm probably the first person who sees them, and it's overwhelming in a way that how happy these people are. So I think it's really just it's so important for them to kind of see this as, okay, here's the option that I need to take. I need to make the choice, and then I need to go forward and live a better life and a healthier life. So hopefully we can make some impact on people's lives, and we can help more people in time. Dr. Erkan, thank you for joining us today. And
Thank you. Thank you.
we'll be back next week. All right. Thank you so much.
Yep.
Have a nice weekend.
Have a good night, everyone.